Hello team, welcome to another ATP Geopolitics video with myself, Jonathan MS Pearce. This is a US political analysis of essentially RFK Jr. and what's been going on in the last couple of days with regard to the guy who's in charge of HHS, Health and Human Services, essentially the health secretary in the US. I want to do a video on Angela Rayner, Deputy Prime Minister that has just resigned in the UK. Don't know that I will not have time to do one today, but look forward to that video if you are interested in that subject. Okay, we're going to start a little bit further back with CDC, so the leader of the CDC being purged, and then a bunch of high top-ranking CDC officials resigning in protest. I think 4 in the end. CDC leaders leave as the directors pushed out. They say RFK Jr. and the Trump regime are weaponizing public health and generating materials that do not reflect scientific reality. So, yeah, there was a big sort of walkout there. And as CNN wrote sometime back on the 29th, science or Trump, the impossible choice faced by the ousted CDC chief. So do I follow the evidence and data and science, or do I follow the demands of a Trumpian agenda and ideology? I can't do both. And so if I'm going to follow science, then my position here essentially is untenable because they want to eschew science in favor of ideology. And so it's very difficult to be in charge of something like the CDC when that is the case. So the White House on Thursday, this is sometime back, laid out the choice after the firing of CDC Director Dr. Susan Monterez, after she clashed with Health and Human Services Secretary Robert F. Kennedy Jr. over vaccine policy and declined to dismiss top agency officials. Quote, "It was President Trump who was overwhelmingly re-elected on November the 5th. This woman has never received a vote in her life," White House Press Secretary Caroline Leavitt said. "If people are not aligned with the president's vision and the secretary's vision to make our country healthy again, then we will gladly show them the door." So if you want to get rid of all vaccines, for example, vaccine mandates, then you are going to clash with the known science, right? And you, as someone in charge of the CDC, you've got a choice. Do I go with the ideology or the science? She went to science and got fired, and people were left with her. And that's kind of a fairly decent synopsis of everything that is going on with the CDC right now. Now, just before we get on to the absolute disaster that was RFK Jr. in a committee hearing yesterday, we're going to talk a little bit about the replacement for Monterez. So the tech bro takeover the US continues while CDC employees clap out their principal leaders who resigned. Trump swears in a 2-decade Peter Thiel advisor to lead the CDC. You've heard me talk so often about Peter Thiel being at the heart of the administration, that tech authoritarianism is a real problem, that these tech oligarchs are using the US foreign policy and attacks on the EU and potential sanctions of EU members, not member states, EU members, as a way of protecting the power of the tech industry in the US, so that there is no regulation in Europe. There are no taxes on tech companies and so on and so forth. So Peter Thiel with Palantir, who already holds the information key to the United States and has so much data on everyone in the United States, including illegal immigrants. And Palantir have just signed a deal with the NHS in the UK. So it's all very worrying. But this Palantir crony has been signed into, has been sworn in to lead the CDC. Now, Thiel's Palantir already has all your data, says Capital Hunters here. He controls your VP, Vice President, because actually Peter Thiel was the guy that got literally JD Vance to the vice presidency, actually got him to become Ohio senator. Previous to that, Vance was working for Peter Thiel, his hedge fund, and then he's now vice president. The nomination wasn't Trump's own. He was convinced by these tech oligarchs. Now he controls your public health too. So the White House has named Jim O'Neill, RFK Jr.'s top deputy, as acting CDC director after firing Susan Monterez. The move paves the way for Kennedy's anti-vaccine agenda to reshape federal health policy. No one's even trying to hide that Teal takeover anymore. Jim O'Neill's been a key Teal lieutenant for nearly 20 years. He ran the Teal Foundation, Teal's Clarion Capital and Mithril Capital, the one that employed JD Vance. Jim O'Neill's not just a Teal lieutenant, he's a true acolyte, pushing all Peter's fruitcake ideas, building government-free floating cities, achieving eternal life, getting kids to drop out of college, and he says drug safety testing is for wimps. The new head of CDC is not a doctor or a scientist. He is a humanities major who caught Peter Thiel's eye and spent 2 decades fluffing his Mad King dreams. O'Neill ran Clarion Capital into the ground. It lost 90% of its value, but Peter kept him on. Nothing in Jim O'Neill's history prepares him to safeguard our public health. What he's prepared to do is impose Peter Thiel's visions. And if Trump fades and Thiel's protege, JD Vance, takes the presidency, Thiel will own the government bottom to top. Why does this account cover Peter Thiel? Because Peter Thiel has groomed the alt-right influencers who brought the crowds to the Capitol on January the 6th, 2021. He wanted power then and didn't get it. Now he's taking it. People need to see the danger and fight back. I absolutely am on board with recognizing the threat to American democracy that Peter Thiel provides. So it just keeps getting better, says Ron Filikowski, as here Liam McElrath says. Jim O'Neill is a tech investor, former CEO of the Thiel Foundation and co-founder with Peter Thiel of the Thiel Fellowship. He has no direct medical education or experience, yet he is now serving as acting head of the CDC. Worried? You should be. Okay, and then we had this, and I played you this video previously on I think a live, but this is so worth listening to. This is one of the 4 who resigned after Monterez was fired. Top CDC official, giving you an insight as to how the CDC was not so much run as how it was used by, or not used at all, by RFK Jr., who in his position as Secretary of HHS, you would think will be pulling on the expertise of the CDC to understand how to shape health policy. Alas, no.
I think that, first I want to say one thing in response to something Dan said. So I think that an important thing to ask the secretary is, has he been ever briefed by a CDC expert on anything? Specifically measles, COVID-19, flu. I think that people should ask him that in that hearing.
What would the answer to that be?
So the answer is no. So no one from my center has ever briefed him on any of those topics.
Really?
So I don't know where he's getting his, really.
No one has ever briefed him on any of those issues that you just mentioned there, including measles, given the outbreak in the United States right now?
He's getting information from somewhere. Yeah, he's getting information from somewhere, but that information is not coming from CDC experts who really are the world's experts in this area. Like, folks from around the world call us with questions around these infections. And we are seen as the expert. CDC is seen as the expert in these areas. CDC is the preeminent public health organization, I'm going to say, in the world. And he's not taking us up on several offers to brief him on these very important topics.
Why do you think that is?
On the issue, I don't know the answer. Perhaps he has alternate experts that he may trust more than the experts at CDC that the rest of the world regards as the best scientists in the areas.
That should worry you if you are an American citizen. The person shaping health policy is not referring to the eminent experts in the fields. Just incredible. And in fact, if you're talking about health expertise, this is RFK Jr.
We had 11 vaccines and it had doubled. By 2006, under his watch, it went to 54%. And I will tell you this, that every child is damaged. 54%, those are the kids who made insurance claims. What about the kids who lost IQ, 1 or 2 points, who are depressed, who are not functioning, who are socially awkward? All of these injuries that are invisible from the vaccines. We know, if you've ever compared an unvaccinated kid to a vaccinated kid.
No, I don't know this.
the bright eyes and the engagement and the social interactions and the curiosity and the affection and you compare them. The child even had 1 or 2 vaccines and they're completely different. And
there's absolutely no evidence for this. So it's really interesting. I think it was Jake Tapper, who used to work with RFK Jr., said he's never worked with someone that lies as much as RFK Jr. Wow. I mean, the idea that you could sit at some kind of conference and say that any child that's had a vaccine is more socially awkward, damaged, more poisoned, has duller eyes, has less engagement, has less curiosity and affection than unvaccinated kids is just absolutely insane. And it's just not true. He is lying. And as many have said, he lies with wild abandon. This just, again, saying to
there's no
Freeman
vaccine
here,
that is, safe and effective.
Those are big words. What about the polio? Can we talk about the?
Well, here's the.
And that's absolutely true to challenge him on polio. There's no vaccine that's safe and effective. How about polio?
Those are big words. What about the polio? Can we talk about the?
Well, here's the problem.
Yes.
Here's the problem. The polio vaccine contained a virus called simian virus 40, SV40. It's one of the most carcinogenic materials that is known to man. In fact, it's used now by scientists around the world to induce tumors in rats and guinea pigs in labs. But it was in that vaccine. 98 million people who got that vaccine in my generation got it. And now you've had this explosion of soft tissue cancers in our generation that kill many, 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 many more people than polio ever did. So if you say to me that the polio...
That's just not true. Yeah, I'm fact checking it here to the side. It's not true. No, the polio vaccine did not kill more people than it saved. There was a defect in Qatar Laboratories vaccine in 1955 that caused 40,000 cases of polio and paralysis in 164 people and 10 deaths. It's been reduced by 99% polio, and it's one of the most successful vaccinations, I think, in the world. So just is absolute nonsense. And then you get Stephen Miller here just claiming that RFK Jr. is one of the world's foremost experts on public health.
And we are working hard. And more importantly, Secretary Kennedy, one of the world's foremost voices, advocates, and experts on public health, is working hard to restore the credibility and the integrity of CDC as a scientific organization committed to the scientific method and getting to the root causes of the public health epidemic in this country.
That's just that's an absolute lie. Just a whole big lie there. He's not that. RFK Jr. is not that. And he's not embracing science. He is eschewing science in favour of a prejudged ideology. And then we hear that 1,000 former employees, I mean, this is huge, of current and former employees, of the CDC have written a letter condemning RFK Jr.
This morning for the HHS Secretary's resignation, and those calls coming from inside the Department of Health and Human Services itself. More than 1,000 current and former HHS workers are making this demand in a new letter released just this morning. They say his leadership has, quote, put the health of all Americans at risk. CNN's Meg Terrell is here with much more on this. Tell us more. You've seen this letter. What more are they saying here?
Yeah, so of course this follows a letter that they sent after the shooting at CDC's headquarters in August. And they say they haven't received a direct response from Secretary Kennedy to that letter where they asked him for more protection for HHS employees. And what they said was to stop spreading misinformation that they said put them in danger. Now this letter is explicitly calling for him to resign, and they are asking, if he declines to do so, for the White House and Congress to step in and appoint a new HHS secretary. So some of the reasons they cite here that they say are putting the health of all Americans at risk include the firing of the CDC director last week and the resignations that prompted of multiple CDC leaders afterwards, the appointment of what they call political ideologues to multiple vaccine policy positions, both advising the CDC and within HHS, and the rescinding of COVID-19 emergency use authorizations by the FDA without what they say supporting data or showing the methods for supporting that.
So talking about science, the people, these ideologues, are making decisions without supporting data. And let's have a listen to one such kind of ideologue. This is the Surgeon General, Joseph Ladapo, from Florida, saying that they are going to end all vaccine mandates for schools and for children.
Every last one of them is wrong and drips with disdain and slavery. Okay? Who am I as a government or anyone else, or who am I as a man standing here now to tell you what you should put in your body?
So vaccine mandates are, if the government is serious about the safety of their population, which should be the number one priority. So if you don't have a population that's alive, then you can't get taxes out of them, right? So, you know, some people say security is the number one responsibility of the government. Health, which, you know, you can argue health falls onto that. Then, you know, vaccines are a pretty important component of that. And of course you want safe vaccines. But vaccines have been proven to be an incredibly important tool. And vaccine mandates an incredibly important tool, because if you don't have your full coverage in the population, then you've got problems. And to just get rid of vaccine mandates in Florida, that spells trouble for the whole of the nation. You need that consistency across the nation in order for vaccines to work. So it looks like the US is just giving up on vaccines. They've defunded through NIH funding cuts all sorts of research into mRNA vaccines and lots of other things to boot. You know, the health domain is being assaulted in America as you know, as we speak, really. Here, Governor Newsom says unhinged government in answer to what is going on in Florida. So Florida School District pulls dictionaries and encyclopedias as part of inappropriate content review. Florida becomes second state to ban fluoride in public water. Florida bans rainbow crosswalks. And Florida's 6-week abortion ban is now in effect, curbing access across the South.
In California, you're talking about...
So you have that to add to the vaccine mandate restrictions. So then we have Joe Walsh then getting on to giving us a synopsis of what took place in Congress when RFK Jr. was essentially destroyed. And it was really, really embarrassing. So Larry Sabato here says, I've watched hundreds of congressional hearings over 55 years. Rarely, if ever, have I seen a witness so thoroughly destroyed as RFK Jr. has been today. Joe Walsh, a former Republican, says, and sadly it won't matter at all because every Republican senator who voted to approve RFK Jr. back in February knew he was utterly unqualified to oversee the nation's public health. They all knew he wasn't a scientist or a doctor. They all knew he was a whack job, a former heroin addict, a sexual deviant, and a nutty conspiracist. And yet they still voted for him because they're cowards, and these Republican senators, more than Trump and more than RFK Jr. himself, will be responsible for every American who gets sick and dies because of what RFK Jr. is doing. That is a pretty bold statement. So we're going to now look at a number of these, and my goodness, they are nuts. There are so many to draw from, though. I've just got a couple. But let
me ask you another question.
Is Senator LaFonso Warren.
How much are Medicare Part D enrollees expected to pay for prescription drug coverage next year?
I think that is in debate right now.
Let me tell you.
Are you talking about the rate?
They are going to pay $15 more than last year, up to $50 a month. Now, let me have a question for you on Part B. How much are Medicare Part B premiums expected to increase next year?
I don't know. I talked to Dr. Oz
that is about,
I think it's
they're supposed to increase about
16%.
11.6% or $21.50 more each month. And again, last time we were before me, you couldn't answer the questions of the very agency and the authority that you have to address these issues. Let me ask you another.
Absolutely incredible. So he doesn't know the basics of what's going on, at least according to Warren here. Just incredible. Here is this?
You said, and I quote, "I stand with President Trump to say, no more middlemen, no more foreign freeloaders, no more skyrocketing drug prices. We're putting American patients first and taking on big pharma to make America healthy again." Yet your record tells a different story. In July, Republicans handed big pharma a massive win. Their big, beautiful bill that they just passed shields billion-dollar drugs like Keytruda, the world's top-selling cancer drug, from Medicare negotiation. Why aren't we negotiating those and bringing those down for families? Why does the bill exempt those?
It's part of the MFN negotiations. I'm not sure that provision in the bill of the one beautiful bill, but
You're not sure of the provision, the negotiation provision, and how exempted
for
Keytruda? Your agency is responsible for that negotiation, and you don't know about it?
So this is the idea that RFK Jr. is supposed to be against big pharma, right? And yet the one big beautiful bill has safeguarded certain drugs from being negotiated. Now, in case you don't know, one of the big problems with the American healthcare system is that it's essentially controlled by big pharma because there's no negotiation. There's no centralized healthcare. Like in the UK, you've got NHS Trust, but you've got NHS England, and then we have and different organizations. But then we have an organization, or Quango sort of organization, called NICE, N-I-C-E. And that negotiates drug prices on behalf of the NHS, right? And then 25% of the world benchmarks their prices on what NICE agrees. So NICE are really, really important, and they drive down prices of drugs. I've been, both a victim of that. So basically, when I was diagnosed with primary progressive multiple sclerosis, there was no treatment, so I went and got stem cell treatment for it. But then a drug came on board, but when I was diagnosed, it wasn't. The NHS weren't providing that drug for sufferers because the drug company had gone to the NHS and said, here's a drug for primary progressive multiple sclerosis. They looked at their data and said, well, the data is not good enough, first of all, and the price isn't good enough. And if you can't just come to us and say, we're going to buy that. So you can come back to us, and if the price is right and the data is better, then we'll take that on. So what happened in the intervening period, I was then diagnosed, there was nothing available. But then after a while, a drug did I don't take that drug because I had stem cell treatment, but the drug came online precisely because NICE did their job and managed to barter that drug down to a price that taxpayers would be more willing to pay for, as it's, the NHS. But in the US, there's no organization doing that. So basically, the drug companies just charge effectively whatever they like, which is why you get extortionate prices for really simple things like insulin and inhalers, and people go across the border to a universal healthcare system like Canada's, and they buy drugs across the border and then come back into the United States. And she's saying, well, if you're so against the big pharma dictating all of this, why were there exemptions for these drugs for negotiating that were written into the big beautiful bill? And he just doesn't have an answer for that. There's no answer. Here so much more. I don't want to go on too long here, but yeah.
Now, you said that you're soon going to release a study claiming to reveal the cause of autism, timed unsurprisingly with the upcoming ACIP meeting to justify taking vaccines from Americans. Now, as you know, autism affects millions of children, so I guess you'd have the nation's top medical experts working on this. Mr. Kennedy, you hired a man named David Geyer to conduct this study. Is that correct?
No.
Is Mr. David Geyer working for HHS?
He's a contractor, but he's not conducting a study.
He's a contractor?
He's a contractor.
Do you know who works for you, Mr. Kennedy?
Yeah.
Do you know that Mr. Geyer is listed as a HHS on the employee directory as a senior data analyst, not a contractor?
He's a contractor. He's not an SGE.
So is your website wrong?
He's not an SGE. I don't know what.
I'm going to pull up the website for you.
He's a contractor.
If the website says he is a senior data analyst, will you at least admit to the committee
Well, I don't know
if
if a contractor can be classified as a senior data analysis or not.
Is Mr. Geyer a doctor?
No.
Did you know he never went to medical school?
He's not. He's not practicing medicine.
Did you know that he got caught in Maryland and was charged for practicing medicine without a medical license?
He was charged by a medical board. He sued the medical board, and the medical board was found to have acted in actual malice and was fined $2.6 million by a judge in Maryland for doing that.
See, so you choose to know a lot when you want to know a lot. It's incredible, Mr. Kennedy.
Senator, you're ridiculous.
So here's the question I have. You brought him in to do this study. I think there's no question about it.
I told you he's not doing a study.
Is he participating in the study?
No.
Is he doing any analysis in regards to this study?
No. What he's doing is getting access to the Vaccine Safety Data Link, which is the biggest repository for vaccine information that your friend would not give us for 7 months. For
Mr.
7 months.
Let me ask you this question, just because you know the answer. What is Mr. Geyer doing?
He is the only one, because Congress ordered CDC to open up the VSD to him in 2002. He's the only outsider who's ever seen it. So because CDC will not give us, they have
Mr. Secretary, is he participating in this then?
No, he is.
You just said he's the only dude that knows what's going on here.
Do you want me to explain it to you, Senator, or do you just want to showboat?
I'll submit
You
this.
just want to showboat for your ads, or do you want to hear a real answer to your question?
Mr. Secretary.
And that's the sort of fractiousness that this was all about. And actually, RFK Jr. was pretty fiery, as you can see there. Now, this is Senator Cantwell, where she just goes to town on RFK.
This also deserves a Nobel Prize, but our mRNA vaccines that we're working on, the ones that we canceled, which are for upper respiratory infections alone,
You canceled $500 million of research because the mRNA technology is about continuing the research to be ready for the next flu, influenza, the next pandemic, and you have to do the research.
I'm happy to have a detailed discussion with you about it. You're so wrong on your facts.
You're interrupting me, and sir, you're a charlatan. That's what you are. You're the ones who conflate chronic disease with the need for vaccines. The history on vaccines is very clear. This is the 20th century. That's how many people had vaccines and had illnesses. This is the 21st century. This is the decrease, 99% down to 100%. This is what was delivered with vaccines. And you don't want to support that. You don't want to support that evidence. So yes, the governors of the West, Washington, Oregon, and California, will take up the efficacy of science. Yes, the University of Washington will deliver the science that America will depend on, because you don't want to depend on it. In his own
So the accusations that he is a charlatan, like to his face, pretty astounding there. Now, this was this was a really important one, because this is a Republican, and this is Bill Cassidy, who was previously a doctor, as far as I understand. So he's got some kind of expertise in this area, and he was quite reticent. He was reluctant to vote RFK Jr. in. But he had his fears allayed, and then he's kind of since come to regret it, it appears. And he catches RFK Jr. out with this.
And I'm approaching this as a doctor, not as a senator. I am concerned about children's health, seniors' health, all of our health. And I applaud you for joining the president in a call for radical transparency. Thank you for that. I said yesterday, I believe it, that President Trump deserves a Nobel Prize for Operation Warp Speed.
Just to let you know, Operation Warp Speed was the reaction to the pandemic and getting vaccines out there as quickly, in warp speed, as quickly as possible, and administering them to the population and saving as many people's lives as possible. And many people will say that that was the most successful thing he did in Trump 1.0. And here Bill Cassidy is saying he should get a Nobel Peace Prize for this. Do you agree?
If he had been President Obama, he would have gotten it. But because of Operation Warp Speed, forcing the federal government to come to a vaccine development within 10 months when others said it couldn't be done, we saved millions of lives globally, trillions of dollars. We reopened economies, an incredible accomplishment. Mr. Secretary, do you agree with me that the president deserves a Nobel Prize for Operation Warp Speed?
Yeah, absolutely, Senator. That was phenomenal.
Let me ask you, but you just told Senator Bennett that the COVID vaccine killed more people than COVID.
Wait,
that was a statement.
I did not say that.
Okay, then let me ask, because you also were
Senator, I just want to make clear, I did not say that.
We'll check the record. That's a question of fact. You also said that you were also, as lead attorney for the Children's Health Defense, you engaged in multiple lawsuits attempting to restrict access to the COVID vaccine. Again, it surprises me that you think so highly of Operation Warp Speed when, as an attorney, you attempted to restrict access. But let me ask.
I'm happy to explain why.
I had 3 minutes and 30 seconds left.
So he absolutely catches him there by saying, well, you've criticized the vaccines over here, but you've now just said that Trump should get the Nobel Peace Prize for that. And by the way, if you want to see, he referenced an organization that he advocated for, worked for, and that organization and RFK Jr. himself were responsible for a measles outbreak in Samoa, where he... it's incredibly controversial, that. So if you want to go and do some like homework, if you like, there are children who died in Samoa, arguably as a result of RFK's misinformation and dangerous approach to vaccines there. So measles deaths in Samoa. This is Raphael Warnock, the Georgian senator, saying the following.
Did you say that the CDC was, quote, the most corrupt federal agency in the history of the world?
Not the history of the world, but definitely
did you say
HHS.
Did you say that?
I did not say that, but I did say it's the most corrupt agency in HHS.
And by the way, an awful lot of stuff he says he didn't say, people have fact-checked, and he has said it, right? So every time he goes, I didn't say that, it's quite easy to go and be on his side and say, oh, poor guy's being attacked by these people. I think they're misinterpreting what he said. When he says I didn't say that, at least a number of times, he has actually gone and said that.
And maybe the government.
So you call the CDC corrupt. Did you say that CDC staff are, quote, horrible people?
Horrible people?
Did you say that they're killing children and they don't care?
No.
Okay, I think that we all have a history of listening to you and these answers.
In other words, you did say that because I've got them written down here. You said those things.
But you're on the record for a number of these statements. Despite your lack of credentials and expertise, clearly you have an agenda. It is a threat to the public health of the American people. It's clear that you are carrying out your extremist beliefs. Which is why you attempted to fire Dr. Menares. Sir, did you?
And there you go. And then here we have RFK Jr. Answer another question.
Today we got new data that showed that infant mortality has increased in this country in 2024 for the first time in 20 years. Diabetes has gone up 98% in 20 years. Nobody's doing anything about it. CDC's job was to make sure that this didn't happen. And what we're going to do is reorganize CDC, but also we've already righted the ship at NIH, at FDA, at CMS. And we are going to end the chronic disease epidemic.
And that's an absolute lie again, because Under RFK's watch, the NIH cancelled funding for an ongoing 30-year study tracking patients with diabetes. Like, you can't start to do work, righting the ship, if you like, of the diabetes pandemic in epidemic in the US if you don't have the data on it, and you've cancelled funding for the data. It's just absolute insanity. And then, here's an example of what I was talking about just before. RFK Jr. is busted in a major lie. Senator Tina Smith slammed him for blaming the Annunciation school shooting on antidepressants, SSRIs, on Fox News. He denied he said it. Listen to the clip yourself. He did say it. This isn't just dishonest, it's dangerous.
Last week, in the days after the tragic shooting at Annunciation Catholic School in my home state of Minnesota, you went on Fox News blaming school shootings on antidepressants. You have no evidence of that because you have no evidence of a connection. And you want to talk about...
You're just saying something. You're just making stuff up.
The person who's trans, that was transitioning, are you going to be examining at all some of the drugs that are used in order to make that transition happening, to see if it plays a role? Because we also know there was a trans shooter in the Tennessee situation.
Yeah, we are doing those kind of studies now at NIH. We're launching studies on the potential contribution of some of the SSRI drugs and some of the other psychiatric drugs that might be contributing to violence. Many of them on there have black box warnings that warn of suicidal ideation and homicidal ideation. So we can't exclude those as a culprit, and those are the kind of studies that we're doing.
Now, you can, words are important, right? So there were some modal verbs in there, and there is a degree of possibility. So might, can, suicidal ideations on the black boxes, and etc., etc. So you can actually put a bit of a defense for RFK Jr. So if you see what she says here.
Days after the tragic shooting at Annunciation Catholic School in my home state of Minnesota, you went on Fox News blaming school shootings on antidepressants.
So there is a case to say, actually, I was saying we're going to look into that because et cetera, et cetera, et cetera. They might have contributed. So there is a case to make to defend his position of saying, I didn't say that. But he didn't, of course, defend himself with that. He just says, I didn't say that. It'd be nice to have heard him correct her more formally. Now, what happened is then because this was I've given you 10%, and some of those aren't some of the really, as you heard, there's some really fiery exchanges. And Bernie Sanders, I think, went to town on RFK Jr. Completely. So it was seen as just a huge disaster. And then you get people like Mark Wayne Mullen coming out and defending RFK Jr. But look at what he does. If you were to say, if you were to guess a way that that a Republican's going to defend RFK Jr. in terms of health, what do you think it might be? How do you think he might end up defending him?
We don't know anything about vaccines. What we're saying is what Bobby's doing is questioning science.
But you're taking
used to it was okay.
You're
going to
risk
science.
kids dying of measles.
We're not going to die. We're not taking the risk of measles. We're not anti.
More kids have died of measles in this country this year than in decades.
Well, if you want to get into that, we can talk about the open southern border and what caused that. Because you had an inflation over 20 million people that came over illegally underneath the Biden administration that wasn't vaccinated. We're not talking about measles outbreaks from kids that were born and raised here inside the United States. We're talking about ones that were brought over here illegally. And you can make that connection. There's no one can argue that.
Okay.
So interesting that his defense of RFK Jr. goes to immigration. It was all immigration's fault. I don't want to get into the debate about, whether you can connect the measles outbreak to the southern border. What I will just quickly go to is this Johns Hopkins Bloomberg School of Public Health piece on controlling the measles outbreak in the Southwest. And they talk about obviously the outbreak, and interesting that the outbreak started in a Mennonite community in West Texas where there are low vaccination rates, right? So not to do with people coming over the southern border. Many of the children are homeschooled or attend smaller private schools, and many are unvaccinated. That's not atypical for the larger outbreaks that we've seen in the US in the recent past. In 2019, the US saw 1,274 measles cases, including a large outbreak of slightly more than 900 cases in the Orthodox Jewish community in New York. 2014, a measles outbreak of 383 cases in the Amish community. So, it's unvaccinated people, and this is a Mennonite community, not particularly the southern border. These larger measles outbreaks tend to occur in close-knit communities with very low vaccination rates. And then are the outbreaks in New Mexico and beyond Texas connected to these? Yes. So again, that's not the southern border causing that. It spreads from place to place within the US. Now, what are the challenges to stopping the outbreak? In the current outbreak, he said, in the US, however, measles vaccines are readily available. The problem is on the demand side. It's a complex issue that requires addressing people's concerns about the measles vaccine, having the right messages to get the information to communities. It requires talking to people and trying to address misunderstandings and probably misinformation and disinformation that they're hearing. In the current outbreak, it may be religious leaders who need to be trusted messengers to provide information and address the concerns of the community, so on and so forth. So, there's a lot of disinformation and misinformation flying about, and it's just interesting to hear Mark Wayne Mullin pivot there to blaming immigrants coming across the border for that. And I'm going to leave you with, again, Caitlin Collins talking again to Dr. Dimitri Daskalakis, who was working just under Monarez in the CDC before he resigned because of what RFK Jr. is doing.
Apart from your former colleagues today who were watching the incredibly combative hearing, what they have to say about it?
I mean, yeah, we definitely have been talking with each other, and I think mainly we were just stunned at the number of mistruths that we heard. We heard that David Geyer was not doing research. That's not true. He is, in fact, doing research. He is looking at the vaccine safety data link. You can talk to my colleague, Dr. Jernigan, who can go into great detail on that.
So that goes back to that fire exchange where we didn't really get a resolution to that because the clip cut off. But here you've got Daskalakis saying, he is completely involved. And RFK Jr. is not telling the truth about that. And I know because I'm working there.
We heard that we briefed him. That is also untrue. We heard that he never told Susan that she shouldn't be involved in making any decisions for vaccine policy. That is also untrue. We heard him evade the answer about how many people died of COVID. I think that he just doesn't want to answer the question.
I didn't include that, but that's a really good clip, by the way. The whole COVID discussion where he's like, I don't know how many people died of COVID. What do you mean you don't know? That's like one of the main concerns at the moment in your domain. You should have those stats. And if you don't know it in your head, you should have your files. You should be freaking prepared. You're the secretary of the HHS. For goodness sake, come prepared.
Because he wants to minimize the impact of vaccine. So we were sitting listening to this going, we can't believe the state of our country that the head of the health agency for the United States is actually standing before Congress, just continually making things up. He did not tell the truth.
So you're saying he lied to Congress?
He lied to Congress.
And that's all you need to know. Go and check some of the Jake Tapper articles because he's had some run-ins with RFK Jr. before and called in what is it, wild? His accusations on RFK Jr. for being very liberal with the truth. He lied. He lied under oath, I presume. He lied to Congress time and time and time again. He's not an expert, even though Stephen Miller will have you believe otherwise. He's not an expert in the required field. He has no expertise and qualifications to do the job he's doing. The Trump administration is not serious. They are not serious about governing. And people will die.